Hi, welcome to Cat Talk by Alice Cat Expert. Today is the first episode of this podcast. So I suppose I need to do a little bit of introduction of myself. I'm Alice Chau. I'm a clinical animal behaviorist specializing in cats. I've been working with cats since 2009, so I have worked with many cats and the human. Before I go into what I have done in the past numbers of years, maybe I need to explain a little bit what a clinical animal behaviorist is first, because there seems to be a lot of confusion out there. Clinical animal behaviorists work with animals and their people to help them to understand and address behavioral concerns. A lot of us will work in private practice on a one-on-one setting, supporting animal and trying to find solutions for the animals and their family. Some behaviorists also do teaching and media work, such as myself. I suppose this podcast is kind of the extenuation of those media work. There are also some colleagues who might not be doing private practice. They might work alongside of a vet clinic. For example, designing the care plan for a particular animal who struggle a lot going to the vet clinic. They might also provide consultation in the clinic itself. Very often, I see it's more often with dog specialists than cat specialists because it's more difficult to see cat behavior in a clinical setting. I also have colleagues who might work in a rescue facility setting to assess rescue animal and improve the quality of their life in the shelter setting. So essentially, that's what we do. Oh, some people might also go into not necessarily doing clinical work. They might do consulting roles, such as product development with different companies. Myself, I do a lot of private practice, one-on-one consultation to solve cases. Um, I also do a lot of teaching work and media work, but my main chunk of work is one-on-one private consultation. So that's what I do. And as a result, I've seen lots and lots of cases, and I think it's a good idea to start this podcast to bring some of those experience and information to bigger general public. So yeah, why do I create these shows? Because I noticed over the years, particularly with the rise of social media, there are lots of information out there, which is good and bad at the same time. Good is that I'm so glad that there are more people realize that cat behavior is a thing. Because when I started my career, on 2009, there are people who don't even know this keyword, so they don't even know what I do or what is this. I'm so glad that there are people out there now at least know this is a word that you can put in your search engine to look for help. However, with the rise of social media, there's also a lot of misinformation out there. Sometimes some information could be confusing, contradictory, and also totally wrong. It might also sometimes be totally outdated. People could be quoting training techniques that is from 30 years ago that we don't do anymore. So there are a lot of that. And of course, in the future episode, I will, debunk one by one. Um, by going to wrong information or out of date information, a lot of my clients come from, to be honest with you, I think nearly all my clients would have gone on the internet first before they talk to me because that's just what people do. And some of them, as a result, wasted a lot of time and energy. And some of the cases might end up rehoming the cats because they just trying different things that doesn't work, random pieces that they try without a good training plan, without a system. And sometimes they come to me too late, and the window of opportunity is closing because not because the cat can't change. It's because other people of the family just run out of patience and saying, you have 1 week to solve this, or we need to rehome the cat. And obviously, having 1 week to work with me is not realistic. And then also sometimes reading all this information, trying different things, and going to different forums, it end up being a very frustrating experience. Some of my clients might end up questioning themselves. Am I overreacting? What did I do wrong? And then they end up feeling very guilty. Or sometimes there might even be people saying that it's nothing, just cats. They scream in the middle of the night. That's just what they do, which is not true at all. So, the intention of this podcast is to answer some of these questions and provide you with clear information, scientific based, and also without judgment. It's not something you do, you might just didn't notice. And I'm here to help you. Now, today's episode, the main focus is I want to let people know that behavior isn't random. Okay, as you have probably heard in the intro, I said behavior isn't random. There's always a reason. In my work, I try to keep myself humble. I rarely ever use the word always because every time I say always, there's going to be a cat next week to prove me wrong. So I try not to be cocky and I try to keep myself humble. This is a learning experience for me as well. And I'm always learning. You have to be always learning when you work with animals, okay? However, this is one of the rare occasions I use the word always because is always and nearly always that behavior isn't random. When your cat exhibits certain behavior, there is a reason behind. You might disagree with the reason, you might not like the reason, but there's a reason. And usually it's a case that they're trying to tell you something, they're trying to cope with the situation. And they absolutely is not trying to be naughty, jealous, paying revenge, all those adjectives that I hear all the time. And what then why are they doing certain things? That there's so many reasons. Obviously this is, I can't list all the reasons, but generally it come under several categories of problems, such as physical problem, pain and discomfort, illness, or aging could be one of those things. I like to explain to people all the time. We are all aging, including myself, okay? So what they have been able to cope with before when they were 2 years old will be totally different when they're 12. So it's just that because our cat is so darn cute, okay? And we tend to forget that they're not a baby anymore. They're aging, they are getting into middle age, and then maybe even elderly stage. A lot of my clients, it's not intentional, but they don't notice the changes. So second category of reason is mental health. And clinical animal behaviors deal with mental health. So this is another thing I suppose I need to explain is that we are dealing with different things than veterinarian. Veterinarian, they deal with the physical health side of things. Sometimes they do a little mental health as well, but clinical animal behaviors do mental health only. We're not allowed to give any advice on physical health sides of things. Usually when we run into a case that we notice is a physical health things, side of things, then we will refer back to our veterinarian colleagues. The mental health side of things, what could possibly cause behavioral changes and behavioral problems, such as stress, fear, anxiety, they feel loss of control, they feel their routine is being upset. That are some of the reason why you're seeing behavioral changes and problems. And then category number 3 is environmental factors, I like to call. What it means by that is that maybe there's problem with the resources distribution in the house. Could be how you place your litter tray, food bowl, water bowls. Maybe it's conflict with other animal inside the house or outside the home. Sometimes it's the neighborhood cats that is bothering them. Or sometimes it could be a case that we could have done better with the space that we have, providing more environmental enrichment or mental enrichment. So obviously, all of this stuff we'll talk about all of them one by one in future episodes. But basically today I want to tell you that behavior is not behavioral issue is not a case of being naughty, paying revenge back to you, or or that they don't like your partner or any of these stuff. They're trying to tell you something. There's something in the environment that they're trying to cope and doesn't cope very well. But I said to people all the time, the problem is my patient doesn't talk. So we need to run experiment and try different things until we find out what they're trying to tell us. And what is it going to be physical problems or mental health problems or environmental stuff? We don't know until we do investigation. And this is also why going back to why it's very difficult for clients to go on internet and find random pieces and try different things because if you don't even know why you have this problem first, you're just running around in circles because you're throwing random measures into the mix and see which one sticks. It causes a lot of frustration. You're wasting your time, and crazy enough, you might be wasting money because sometimes people think that I don't want to pay for a consultation, but you might end up spending more trying different random things than paying for a consultation. Let's talk about some of the common case I deal with because this is another frequently asked question when I go on media. What kind of cases I'm dealing with? There are several main category of cases I deal with. Okay, litter box is the number one. I think 50% of my cases deal with litter box issue. Okay, um, I joke about this all the time. If all the cats in the world use litter box routinely, religiously, um, then it might have affect my income huge amount. It might affect my mortgage, in fact. So okay, so a litter box is huge, and then another one is aggression, is cat to cat aggression, cat to human aggression, or sometimes even cat to dog aggression. And in those cases, I would be working with a dog colleague usually as a team effort to resolve the two animals' conflict. And then there are also destructive behavior, destruction of stuff, destruction of furniture, and sometimes it's self-harm behavior as well. Is considered to be destructions as well. That is also very common. And then an other category of stuff would be vocalization. This is usually a big complaint as well, particularly in the middle of the night. It affects people's sleep. I literally deal with a case that the sleep deprived person is very upset a few days ago. Now, none of this, to be honest, as I said, none of this is them trying to be naughty, okay? And also, sometimes there's misunderstanding on the internet that people think all these stuff I just listed are training problems, and they're not training problems. They are behavioral problems. We need to take a closer look at why they started this behavior in the first place. And then another thing I want to let you know is that these problems they end up in my consultation, but I don't think they are the most common cat problem, in fact. Let me explain to you why I said that. They end up to be in my consultation because these are the problems that bother people the most, bother the human the most, to the point that they decided to go on my website, enter the credit card details, and try to get help because this is bothering them. The literary problem make the house smelly. The aggression, they worry about walking around the house and worry about the other cat, vet bills, so on. The destruction of their house, obviously. The destruction of the cat himself, like self-harm, of course, again, vet bill. And then screaming in the middle of the night, as I said, sleep deprivation. Um, that's why the people go out of their way to find me and then enter their credit card details. However, I don't think this is the most common behavioral problems. The most common behavioral problem I I would argue is chronic anxiety and long-term stress. Why do I say that? Because we all know cats who hide excessively. Whenever there's visitors, they hide. I'm not saying they shouldn't hide. They should if they're nervous, but I mean excessively hiding. They will be hiding for half a day, and then their appetite will be affected. Or they are very triggered every day when the delivery person comes in. Um, and then they run away, they freaked out, and then there are also cases where they can't go to the vet, they can't take medications, they can't put the cream on the area that they need to put cream on. They can't be groomed. You can't get the nail trim. You can't touch them at all. You can't pick them up, or you need to be careful walking around your house, making loud noises, or using the microwave, making coffee. This is not okay. So if there's any take-home message today from today's episode, is to let you know that if you're experiencing some of these things, there is something you can do about it. And it doesn't matter the age of your cat, because that's one of the pushback I get from people is that my cat is older now. They have always been like this. I don't know what to do. It doesn't matter how old your cat is. We might not be totally solve the problem. They might still not like visitor a lot, but we can improve the situation. This I can I can tell you that we can improve the situation. Absolutely. And again, I it doesn't matter if your cat is rescued. There were so many cases where the cat is rescued and extremely scared of people, and eventually with the right training, they will come around. So the chronic anxiety and long-term stress, now that's a training problem. Remember I said the litter box, the aggression, blah, blah, blah. They're not training problem. They're clinical case that I need to deal with in consultation. But all this chronic anxiety, low-key stuff that affects your quality of life and the cat's quality of life, those are training stuff. And absolutely, with the right measure, right implementations, you can improve the situation. So when should we start training then? I am a strong believer in preventative measure. So if you ask me, the first day you get a cat, you need to think about training. For all the stuff that I talk about, you should be able to train your cat to go to the vet, be in touch, getting nail trim, being groomed, um, and you should be able to have visitors coming into the house. They don't need to interact with the visitors if they don't want to, but they shouldn't be hiding for half a day and not eating. So it's a case of, you know, spectrum. Okay. So I strongly believe we should start early, but it's never too late to start. That's essentially the case. If you go in early to deal with the behavioral issues, not only the clinical stuff, but also the preventative measure, you will probably deal with less behavioral problems down the road. You will have better relationship with your cats, and the human cat bond would be much better in your family, and everyone get to enjoy the cat better. I mean, the whole point of having a cat is to be enjoyable, right? And by doing that, right, by going in early to deal with the problem or prevent the problem, everyone get to enjoy the cat better, and the cat will enjoy your family better too. So please take behavior seriously. All this stuff, not being able to go to the vet, screaming, or any problem at all is never, that's just being cats. This is another thing that I hear all the time that drives me crazy. People will say that, well, that's just what cats do. No. Okay. And also, oh, they're too old to change. No. Oh, but they are rescue. No. Okay, I want to be straight to you. I want to be straight to you. It is not. No, no, no. Yes, for some cases it's more difficult, but it's not impossible. Okay, there's always, opportunity of improvement. So what's the plan for the podcast going forward? Okay, so in this podcast, I plan to um talk about common cat behavior one by one. All the stuff that I've listed, litter box problem, aggression, so on and so forth. And then also I will talk about preventative measures. So I will talk about training stuff. I will answer questions. So if you have questions, please feel free to send me questions. Okay. If you want to send me questions, please go to podcast at alicecatexpert.com. This is an email address specifically for this podcast. This is where I will get the questions, recommendations, etc., specifically for this podcast. So please go to podcast at alicecatexpert.com. We will also potentially talk about books because you can see here there are loads of cat books. We might talk about books when we talk about the latest research, trying to help you to understand what the research is, what the research talks about. Sometimes it's not easy to understand. And then also I might do like different product review that have something to do with improving your cat's life. Yeah, so I suppose that's the plan for this podcast. And not only you can send me questions, by the way, if you have any suggestion and comment and criticism, who knows, please also email me on podcast at alicecatexpert.com. If you find this podcast useful to you, don't forget to follow and subscribe. And also don't forget to share to other cat people. So that's it for today. Until next time, bye.